Hello, good morning. My name is Omorobi Aidehin Solomon. Yeah, what make me stand out as a new grad is the certificate I've been able to acquire even before I became a student nurse, and now I'm a new grad. I've been able to attend so many clinicals. I've been to mental health, I've been to fundamentals clinical, I've been to peds clinical, I've been to geriatric, I've been to med-surg, I've been to maternity. I've been to so many clinicals, and I've learned so many things on how to care for patients at clinical. And I've worked as a CNA for over 2 years, and I have certificate for that, and I've worked also as a home aide for over 1 year, and this has really opened my mind and on how to care for patients. And the second question is on how to care for a patient that is septic using the SBA. The first thing, which is the situation, you have to know the name of this patient, the sex, the sex, and the day this patient was admitted. Then we go into the background. The background has to do with the history of this patient, the reason why this patient was admitted, and the onset of the disease or the illness. And because sometimes they come to the hospital, the ERO, with a different story or a different thing, and we get to find out that they are septic, which is very, very important. And we have to know their past history, the medications they are taking, so that we don't overdose them. We have to know what they are taking, and from there, if we know the medication they are taking, we can know what the problem is before they came to the hospital. And the other one, which is the A. The A has to do with the assessment. As a septic patient, you have to be very mindful of the assessment. The vital sign is very important. We have to do the vital sign, and especially the blood pressure. It is very, very important. You have most times they are hypertensive, and we have to be very careful with that to know when to treat them. And while we are doing all this assessment, we have to do head-to-toe assessment. We have to auscultate the abdomen. We have to check the hearts, the lung sound. We have to take note in case this patient have extra heart sound. What are we going to do? What's the intervention? That's where critical thinking comes in, and we have to know how to intervene when they are in these situations, or they will find something during assessment. We have to make sure this patient doesn't have edema while we're assessing the lower extremities, and we have to check is the head-to-toe assessment. We have to do everything to make sure they don't have wounds. Whatever we find, we have to document it. And the other one, which is a recommendation. What is my recommendation for this patient? How am I going to care for this patient? What is my short-term goal for this patient? What is my long-term goal for this patient? Well, for me to get a proper result of caring for this patient, I need to have a short-term goal. I need to have a long-term goal. My short-term goal might be, okay, in the next 2 hours, my patient blood pressure is going to be normalized. I can say in the next 48 hours, my patient is going to be free of septic. Thank you so much. I really appreciate your time, and I'll be looking forward for your email, and I appreciate if my resume is considered. Thank you.